Hi guys, welcome back to the Plan Hard YouTube channel. I made a post this week on a social media site about it was 3 years from my rebirth date. And the way I prefaced that was in May 6th of 2020, let me back up. May 4th of 2020, I collapsed in the yard when I was cutting the lawn. It wasn't very strenuous work, but I collapsed in the yard. I called my cardiologist, and because it was the beginning of COVID, and told him about it, and he said, well, we're not seeing anybody in the office. And I said, well, you're either going to see me today in the office or you're going to see me in the emergency room. Now, which do you want it to be? So he agreed to do in his office, and I went in and saw him and explained the situation, and he said, well, Al, you're in perfect health. You know, I just saw you 2 months ago. You're fine. There wasn't anything on your EKG or anything else. I said, well, there's some reason that I collapsed, and the pain in my chest was pretty severe. So he scheduled me for the cath lab the next day, and because nobody was allowed in the hospital at that point, nobody was allowed to go in with a patient, I had to be dropped off at the front door for the cath lab. I wasn't on the I'm sorry. I wasn't on the table for 15 minutes, and the cath lab doctor says to me, there's nothing I can do for you. You need a triple bypass. Well, you could have hit me in the face with a 2x4. I was totally flabbergasted, thinking that, I'd go in there and get a stent or two, and, I'd be out of the hospital the next day. So, as I'm in the recovery room from the cath lab, my cardiologist comes down. He says, I could get in a lot of trouble for being here. And I'm like, I don't even know what he's talking about with this. It makes no sense. But he says, Al, you didn't have a heart attack. But, you need to have triple bypass surgery because the obstructions in your arteries are at the area where they enter the heart, and they can't put stents there. So I said, I've been complaining to you about this problem for the last 5 to 7 years of having stamina problems, and you always told me, it's just because I was getting older. So I was pretty upset with him, and of course, they wouldn't let me go that night. They kept me overnight, and they gave me the triple bypass the next day. Well, you can just imagine how I felt that evening. I was not only mortified, but scared to death. The cath lab doctor said that 2 of my arteries were, one was 86% occluded, one was 87% occluded, and the widowmaker was 99% occluded. They all commented that they thought it was extremely lucky that, number one, I didn't die from it, and number two, that I hadn't had a heart attack, which I hadn't had. So the next morning, I was the first one on the roster to be operated on. And I want to tell you what a triple bypass entails, because I know a lot of you probably have family history that probably scares you to death, of heart disease and heart problems. And believe me, don't take this, this will be my disclaimer. I'm not a doctor, and this is not medical advice for you. I am only telling you what I went through. Of course, the night before, they shaved basically my whole body. They shaved my legs, they shaved my chest, my stomach, everything. When when I awakened from the surgery, and this is just to tell you what you'll feel after triple bypass. I had a main line installed in I guess an artery in my neck with pretty large needle in that. Um, I woke up and of course was cut from here all the way down to the end of my sternum. I had two drains that were installed in the bottom, just a little bit below where the incision stopped. On my leg, now when my father back in 1983 had the same operation, they actually cut the leg. I mean, he had a scar that long with stitches where they actually open the leg and they take the vein out. They don't do that anymore, and it's a pretty wild procedure. They go in arthroscopically, they find the vein that they want, and they put a device down through the vein, the length of the vein that they'll need, and then they have a cauterization device that burns the end of that vein off, and then they pull the vein out through the leg. So in other words, there's only just a small incision there. I think it was one dissolvable stitch was in it. I was operated on a Wednesday morning at 7 o'clock. I didn't wake up that night until about 7 p.m. They had me walking that very night. They told me that I couldn't go home to my two-story home unless I had somebody, number one, to go with me, and number two, that I could climb 20 steps before I left the hospital. That was on Wednesday. By Friday night, I could walk 20 steps. I could do 20 steps. As you can imagine, there was a lot of PT and OT that followed after I got home. I was walking about a half a mile a day in the beginning, and then of course it worked up from there. Now when I was operated on, I was 244 pounds the day of my operation. The doctor told me that, I had a lot of fluid around my heart at that point, and I had lost almost 15 pounds within 2 days from the drains, of course, that were in my chest. They drained off 4 liters of fluid from my chest in the time between Wednesday and Saturday, that when I was released. So, as I got home, you can just imagine that it was, it was quite intensive. And I suffered a lot. After 9 weeks, I was released by the surgeon. I kept telling him that I was feeling pains in my chest. And he, took x-rays and he says, no, you're doing fine, don't worry about it. He gave me full release and he said, just watch your pain level, and if you feel that, if you do something and you feel that that's not right, it doesn't feel right, just slack off and try it again in another couple weeks. Okay. At the same time, I thought, maybe I need to start living a little healthier, and I went on that diet that you see advertised all the time. It's called the Noom, Noom diet. Explained to him what I wanted to do, how much weight I wanted to lose. And I said, I want to lose 70 pounds to get down to my weight. And they said, you can do that in three and a half months. I was totally shocked. Okay, I'll give it a try. So I gave that a try, and I lost, as a result, in 3.5 months, I lost 76 pounds. and I'm hovering right now around 177, 178. So that was for the best. Along with the Noom diet also came an exercise regimen and also a caloric intake recommendation. They had me on 1,400 calories a day. They said they don't care how you get those 1,400 calories, but that's what you have to stay at. And then they started at it. They told me I needed to get a step counter, so I got that as an app on my phone. And they started me out at 3,500 steps a day, and then they increased that over, the 3 month period, and yet kept the 1,400 calories, where they were. So you could eat anything you want. They didn't have any food plans or any of that stuff. You just had to log in every day what your caloric intake was and your step count so that they could monitor to see how you were doing. I did great. I did great until August. Now, you can imagine, from May to August, May, June, July, August, 3 months. I was out doing some yard work, and I came back in, and I went to sit down in my chair, and I felt a pop in my chest. And I didn't know what that was. I had no idea what it was. It was a loud pop, and it was like from right in here. So I went back to the surgeon again. Now you got to imagine, every time I went into the hospital or to see this surgeon, I had to take another COVID test. Thank God I must have taken 7 COVID tests in 2020. So the surgeon looks me over and he goes, well, he says, this was like the perfect storm. I said, well, what do you mean? He said, well, the sternum is bone. He says, and below the sternum is a thing called the xiphoid process, and it's a piece of cartilage. He says, the sternum we wire together, but the xiphoid process, he says, I had to put a stitch in. He said, so I put a dissolvable stitch in it. Well, what had happened is the dissolvable stitch broke before the xiphoid process had a chance to heal. So what it amounted to was I had 2 pieces. I had a piece on each side of the xiphoid process, and they were flipping back and forth. And it got to the point where it was loud enough that if someone next to me could actually hear it. So I said to the surgeon, well, what are we going to do? He says, well, the xiphoid process, he says, really serves no purpose other than to guard the bottom part of the heart. He says, he says, Al, it's no problem. It's only 3/8 of an inch back under the skin. We just make another incision down a little bit lower and we remove it. So he says, it's nothing like what you've already been through. Okay. So I agreed to that. I had the xiphoid process removed in August of 2020. Well, it wasn't exactly as advertised. The xiphoid process, as I read about later on, has a lot of muscles attached to it that are in the pectoral area. So my point was, well, what do you do with those muscles that you severed from the pectoral area? Nobody seemed to know. The xiphoid process, they call it xiphoidectomy, was not a very usual operation. In fact, the nurses in the pre-op said that they had only seen it done once before. Anyhow, at that rate, I had it done. Well, it wasn't exactly as advertised, and I ended up sleeping upright in this chair, in a recliner, for another week and a half. It was too painful to lie down. It was basically the same recovery from that as it was the triple bypass. I went back for my first appointment to my cardiologist, which, of course, as you can imagine, at this point I was pretty pissed off with him. And he very arrogantly said to me, well, Al, I'm I'm a cardiologist, I'm not a plumber. So that prompted me to immediately get rid of him and find another cardiologist. Now we'll fast forward to where we are at this point. I've maintained my weight loss. I'm still 177, 178. I'm doing very well in that regard. I'm up to 10,000 steps a day, uh, which is, close to 5 miles a day that I'm walking. So I'm leading a healthier lifestyle and I'm eating a little bit better and doing all those things. But I got to tell you that the nerve damage that I sustained from the triple bypass and also from the xiphoidectomy have left me with recurring. I guess that might not be the right word. It's a situation that's never left me for the last 3 years. I always have a pain right across here. It feels like I have a broken rib. And the surgeon said to me, he said, well, he says, you may get that feeling back. You may never get that feeling back of normalcy in your chest. And I said, well, I see this as a quality of life problem. And he explained it to me. He said, well, Al, you have to understand that you traded your life for a minor discomfort. All right, well, I can see where he would say that, but then again, this doctor is not feeling what I'm feeling. Would I do it again? I've already said if they ever want to go back in my chest and do another heart operation, I'm not going to do it. But this is just my personal opinion. These are my personal feelings. And hopefully I've given you some insight as to what happens during the operation. Oh, another weird thing. Where they took the vein out of my leg, it had some sort of weird nerve problem there too, because for about 4 or 5 months, it constantly felt like a spider was crawling up that leg. That's minor. I mean, that's no big deal, but I thought it was pretty strange. But anyhow, I've given you videos on, maintenance things around the house and things of that nature. And I just thought from this man who reached out to me and wanted to know more about the operation. His name is Toucan1 Inc. And he's on my social media. So, Toucan1 Inc. This video's for you. Okay, guys. Catch you on the next one. See ya.